Next, we're going to talk about dialysis. As we discussed in our first video, dialysis is not a treatment that fixes your kidney. Rather, dialysis performs the two main jobs of the kidney, cleaning the blood and getting rid of extra fluid, when your kidneys fail. There are two major kinds of dialysis, which use different filters to perform the function of dialysis. We will discuss them both now. The first one is called peritoneal dialysis. This uses the lining of your abdomen as the filter. The second is called hemodialysis. This uses a machine membrane as the filter. Peritoneal dialysis, called PD for short, is a form of dialysis which cleans the blood using a natural filter inside your body, the lining of the abdomen. This lining is called the peritoneal membrane. PD is done at home, and it's done every day. In this way, it is a natural form of dialysis which mimics the continuous way that our kidneys work to clean our blood. In order to perform PD, you need to have a minor surgery to place a tube called a PD catheter into your abdomen. This catheter is what you will then use to perform the peritoneal dialysis. Once the catheter is in place, the process of peritoneal dialysis involves insertion of a fluid called dialysate into the abdomen through the catheter. First, the dialysate bag is connected to the catheter through plastic tubing. The fluid then flows into your belly from the bags that it comes in, a process which takes about 10 minutes. Next, the lining of the belly serves as a natural filter. It lets out the waste and toxins into the fluid, and it keeps in the safe and important parts in our bodies. This process takes a few hours, during which the fluid stays inside your belly. Afterwards, you drain the fluid out through the catheter into a waste bag and you throw it away. Each day, you repeat this in and out process, which is called an exchange, about 4 times per day, using a fresh, clean bag of dialysate fluid each time. This allows for you to clean the blood well each and every day. Once you are comfortable with this process, some patients can switch to an overnight form of PD, where a machine, called a cycler, performs the exchanges for you automatically while you are asleep, freeing you up during the day. There are many benefits to doing this PD form of dialysis. Because it is all done inside the body, these exchanges can be done at home, at work, or even if you are traveling away from home as long as you have your supplies. There are no needles involved, and your blood never leaves your body. Because the blood is cleaned regularly, there is more flexibility in your diet and your fluid intake. This more closely mimics our natural, normal kidney function. As part of peritoneal dialysis, you will establish a very close relationship with your kidney doctor and with the peritoneal dialysis nurses. You will be taught how to order supplies, how to perform the exchanges safely, and you will meet with your kidney doctor every month to check your blood tests and to check in to see how you are doing. The whole PD team is always available to help you if you have any questions that arise while you are at home. Next, we're going to talk about the other form of dialysis, which is called hemodialysis, or HD. This type of dialysis, like PD, does not treat kidney failure, but rather replaces the function of the kidney using a filter. In hemodialysis, the blood is cleaned directly in a machine which contains the filter. The blood comes out of your body either through a catheter in the chest or through a fistula in the arm. It then goes into the dialysis machine where the blood is cleaned and the fluid removed. This occurs in the filter inside the dialysis machine, which allows for the waste products to leave and holds in the important parts in the blood. After the blood is cleaned, it is then returned to your body through the plastic tubing. Hemodialysis requires a way to connect your bloodstream to the dialysis machine, which is called the dialysis access. The best form of dialysis access is called a fistula, which is a connection that is created in between an artery and a vein in your arm. This is created by a surgeon in a minor surgery and takes some time, weeks to months depending on the type, to be ready to be used for dialysis. Once this fistula is in place, at each dialysis treatment, needles are inserted into the fistula in order to facilitate the blood connection to the dialysis machine through the plastic tubing. These needles are then removed from the fistula at the end of the dialysis treatment and pressure held to prevent bleeding. The fistula provides a safe and reliable way to allow for your blood to be cleaned in the dialysis machine. If you do not yet have a fistula in place prior to when you start dialysis, you will need to have a dialysis catheter placed into the chest until you are able to have a fistula placed. Hemodialysis treatments take about 4 to 5 hours. The treatment can either be done at a dialysis clinic in your local area or at home. If you choose to do hemodialysis at a dialysis clinic, your treatments will occur according to a fixed schedule, 3 times per week, on a schedule of either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. In this clinic, you'll be seated on a comfortable chair with the other dialysis patients on your shift completing your treatments. Your doctor will come to see you while you are at the dialysis clinic to review your treatments and to check on you. The staff at the dialysis clinic will take care of the connection of the fistula to the dialysis machine and will monitor you and take care of all of the machine preparation for the treatment.
The outpatient hemodialysis care for individuals who have end-stage kidney disease is provided through local dialysis centers. The dialysis team, including technicians and nurses, will be involved in connecting this patient to a dialysis machine. It's a great team out there, typically comprising of, in addition to the nurses and technicians, a social worker, a dietitian, a physician, as well as a facility manager. And this team will get to know these patients quite well and are also available for questions not only for the patients, but also from their informal caregivers. Typically, there is a monthly meeting, and that's the patients and the caregivers' opportunity to ask questions, to know more about their care, to see what the trajectory looks like, including for other issues like transplantation or access. It's possible that you may be seeing a physician in the dialysis center who is different from the physician that you are used to seeing when you were progressing through various stages of chronic kidney disease. However, keep in mind that we work here as a team, so the nephrologist that was seeing you during the course of your chronic kidney disease is in close contact with the nephrologist who now you are seeing at the local dialysis center.
Some patients are able to arrange to do hemodialysis in their home with installation of a dialysis machine into the home. You will also need to have room for the supplies and a care partner to help you. If you do hemodialysis at home, your local dialysis center will train you and your care partner on how to perform it safely and will provide you with all of the dialysis supplies that you need. The advantages of doing hemodialysis at home are that you are able to complete your treatments at home with your family without having to travel back and forth from a dialysis center 3 days a week. You can time the treatments around your schedule, and you will have more control over your schedule. Home hemodialysis does require a care partner to help you with your treatment, space at home for the machine, supplies and water, and you will need to perform the tasks of preparing the machine for each treatment. Third, the other option to pursue for kidney failure is called conservative care without dialysis. This is a focus on treatment with medications and pills to focus on your quality of life, but not going on to dialysis treatment. Patients continue to work with their doctors to take medications to help manage the symptoms of kidney failure.
Dialysis often involves a major lifestyle change, as well as the physical tolls that not every patient can tolerate. With conservative management, we'll continue to treat symptoms of kidney disease, including anemia, electrolyte imbalance, volume overload, as well as any other symptoms of uremia. We will often team up with our palliative care colleagues and nursing to expand our care at home. Choosing conservative management is not giving up on care, but instead we'll shift our focus on keeping our patient as comfortable as possible and to extend their quality of life to spend time with their loved ones.
The goal is to help you feel as well as possible and to keep you comfortable at home with a focus on your quality of life rather than prolonging life. This decision is a personal one that each person makes for him or herself. You should not feel forced to have dialysis. It's your choice whether you want to do kidney dialysis or not, and your kidney doctor and kidney team will support you in whatever decision you make for yourself. Dialysis treatments do involve a major change in your life. They take up a significant amount of time and they do place some burdens. For some patients, these burdens are not bothersome, and so they choose to continue to do dialysis. For other patients, these burdens may be too much, and they may experience them as something that worsens their quality of life, understanding that they may not live as long without dialysis. Some patients are not sure. They may want to try dialysis for some time and then may change their mind later. This is a very important decision and a very personal decision. It's important to ask questions, discuss this with your family and your loved ones. You are not alone in this process. As your kidney care team, we are here to help guide and support you through the process and to support you in whatever decision you feel is best for you and your family.